Philippek, you talked about some of the causes, and I'd like to ask you to expand a little bit about that. Are there any kind of environmental factors that can also trigger autism?
Well, we don't really know what the causes are. I think one thing to really be clear on is that it's not a singular disorder. Autism or autism spectrum disorders has an S on it. And so there are multiple, they're going to be, when we finally figure out why children are born with the characteristics of an autism spectrum disorder, we are going to have to understand a variety of entities that cause it, meaning that there are a variety of genes that will also be found to cause it. That said, you can't really have the kind of an epidemic that we're having on a pure genetic disorder, so there has to be some sort of environmental interaction. And if any of us knew the answers to that, there'd be a Nobel Prize sitting up here on this table. People really don't understand it yet.
So I don't know if I should ask you this question, but I'm going to go ahead and ask anyway because others are wondering. So why do you think that autism is on the rise? Because clearly, based on the numbers and the stats that we're seeing, it is.
So we clearly know that there's a genetic component because there are so many families that have several children with autism in a single family. Clearly, there is something in our environment that is triggering the genes. And just, this is not going to be a genetics lecture, but just so that you understand, there are diseases that we have found the gene for, like muscular dystrophy, where if that gene is gone, left out of the chromosome, or it's there but it's coded as gobbledygook, not what it should be coding for, you have muscular dystrophy. Single gene disorders like that are relatively easy to find the cause and potentially to find treatments for using a genetic approach. But now, and there are a variety of other types of genetic abnormalities that cause certain disorders. But then there's a whole field that's called epigenetics, EPI genetics. And that is the realization in the field that's evolved from the realization that you can have all the normal genes on your chromosomes, but something from the environment can be turning them off or on. Which means that your standard tests, what have been the standard tests of trying to find the genetics for a disease, won't work because they're not looking for those keys that are turning off and on the genes. So the whole field of epigenetics has come about trying to find what genes are off or on, and that is probably one reason why the autism spectrum is such a broad spectrum as far as clinical presentation and symptoms.
Okay, so before you think I'm picking on you, I do have one last question because what your area of expertise is very important, so thank you for that. If a family hears the diagnosis that their child has autism, what can we tell them as far as any possible cures or treatment? I mean, what can we say to them? What is the process for a treatment?
I personally, I'm not an advocate of talking about cures because there's a lot about autism that doesn't need to be cured necessarily. That's my own personal feeling. That said, there is definitely a need, depending on the severity of the presentation at diagnosis, so depending on how behind a child is, how delayed a child is in all of the areas that we test for when we diagnose autism. The earlier the diagnosis and the more intensive the intervention pretty much leads to the best prognosis.
Thank you,
And
Dr.
so,
Philippek.
depending on the individual child is how a plan for intervention should be. There's no rote black and white map for intervention for autism.
Thank you very much. Dr. Philippek, everybody. Okay, our next panelist, who I'm going to interrogate. No, I'm just kidding. Next one up, we have Ellen Cato. She is with Texana. She's also a board certified behavior analyst. All right, Ellen. For you, I want to talk about funding. What kind of funding can you get to fund certain programs dealing with autism? And I'm going to ask you the two questions I have for you at once. How can we talk about funding? And even though we have our state rep up here, maybe you need to talk to him directly, but just saying. And then how can we identify possible sources of financial support for the families? You know, we talked about the numbers that a family has to deal with when treating a child. So how can we get additional funding in the school system, and how can families get additional financial help?
That's a very large question. And I do actually spend time in Ron Reynolds' office talking about some of these things, and in Austin trying to advocate for more financial support for all of you. My question included, how do you fund specifically an applied behavior analysis program? And that's what I can speak most fluently on, as that's what I do for a living. So I can give you a little bit of information about that. First, private insurance. We were one of the first states in the country to successfully get a state mandate that requires fully insured insurance plans to cover applied behavior analysis and others, as well as other services for the treatment of autism spectrum disorders. You're going to talk a little bit more about that. Unfortunately, all state mandates only apply to fully insured insurance plans, so that does exclude a lot of our policies. We're fortunate that the state of Texas did include, when they wrote the rules for the exchange, all policies purchased on the exchange will also cover applied behavior analysis. So we've had a lot of families that have been really successful going that route for coverage, which has been great. There are Medicaid waivers in the state of Texas that cover applied behavior analysis. Many of you are probably familiar with their lengthy waiting lists. But they do cover ABA as well as other services to help address the symptoms of autism. Some of those include home and community-based services, commonly referred to as HCS, community living assistance and support services. Most of you have heard that called CLASS. Deaf, blind with multiple disabilities, as well as the Texas Home Living Waiver. So all of those are Medicaid waivers that will help fund services for your child. There's also the Medicaid Transformation Waiver, which is commonly referred to as the 1115 waiver in the state of Texas, and there are multiple programs throughout the state, also here in Fort Bend and in Harris County, that are specifically geared towards individuals diagnosed with autism as well as other intellectual and developmental disabilities. So at Texana Center, we have a day treatment program for children in Sugar Land that is solely for children diagnosed with autism that have Medicaid. We have a behavior stabilization team that provides services to individuals 6 and up that is just for individuals with Medicaid. The Harris Center in Harris County also has 2 different programs that are strictly funded through that Medicaid waiver. So that is an option for families that are living in Harris County. I do recommend that all families go to their community center. If you're living in Fort Bend, that is Texana Center. We provide services to individuals of all ages from birth throughout their lifetime with any sort of autism spectrum disorder, intellectual or developmental disability, as well as behavioral health care need. And most of those services are based on your family size, your income, so they are affordable to all families. Just by going through the authority department, you would be assigned a service coordinator. Your child would be given an evaluation in order to determine a diagnosis and therefore eligibility for services. That service coordinator would help place your child on the different Medicaid waivers as well as tell you what other services were available for your child. So I do strongly encourage that. There's a service called the Hub for Local Providers, that the funding source is there strictly to help train parents and caregivers and HCS providers on how to work with your child. So that funding is there and available to everyone. The Department of Assistive and Rehabilitative Services, that's DARS, they're a state agency. They have a DARS autism grant, which is strictly for autism services for children ages 3 through 15. And we now have 4 providers in the Houston area that are providing that service. Texana is one of them, the Harris Center is one of them, the University of Houston Clear Lake, as well as Social Skills Playhouse. So those services are available to families on a sliding scale. So you don't have to have insurance, you don't have to have Medicaid. What you pay per hour is based on your income. And then if you're looking at vocational rehabilitative services, DARS also provides those to families. And those services are being provided at the University of Houston Clear Lake as well as Texana. I strongly encourage, as parents, you're your child's greatest advocate, so hold those public schools accountable and try to get the best services that you can from them. We have an expert on education that'll talk a little bit about that. And Matt's going to talk about some funding that's available from Hope for 3. I also recommend that families go to the FACES website, which is the Foundation for Autism Care, Education, and Service. They've been known to give grants for families just like you for things that you need, as well as Susie Bean Gives. And I know that there's a Families for Effective Autism Treatment board member in the audience, but they are also looking, they're an excellent resource for parents and are going to be looking soon at how they can help families more in the greater Houston area, including Fort Bend. So hopefully that was at least some resources for you.
Miss Ellen Cato from Texana.